Hello, I'm Rhonda Burzel, and I'm the Residency Program Director at UIC Rockford Family Medicine Residency Program. And I'm here today with Dr. Joe Gary, who's professor and head of the Department of Family and Community Medicine at UIC Rockford. Welcome, Joe.
Good afternoon.
We're here to talk today a little bit about our clinical learning in education and addiction. Joe, can you tell us a little bit about the background for this need in our patient population? We both practice here in Winnebago County. Can you speak a little bit to the background of our patient population here in Winnebago County?
We do, Rhonda. Thank you. What we're here to talk about today is our clinical learning and education in addiction program. And this program really came from the fact that much of the United States, Winnebago County not excluded from that, is suffering from very high rates of addiction and substance use. We see that here within our own county. Despite the large numbers of individuals who suffer with addiction, really, Rhonda, 10 to 15% of those individuals will actually seek care or have access to care with their addiction. And so part of what we're doing is trying to change that paradigm to allow greater access. One of the worrisome things about Winnebago County is that we have the highest overdose death rate of all counties in the state of Illinois. And we know that investing money in prevention and treatment will actually save money down the road. So it also makes practical sense that we're addressing this, besides affecting the lives of those who suffer with addictions.
Thank you. In addition to patient care, one of our other specialties at UIC in the Department of Family and Community Medicine is education. Can you share with us today a little bit about the purpose of an addiction medicine fellowship program here?
Absolutely. So a fellowship program is a program where we take a physician who's trained in a specialty, family medicine, medicine and pediatrics, internal medicine, and then we provide them with additional specialized training in addiction medicine so that now these individuals can go out into their community, and oftentimes they are practicing in the same community where they trained, as you know, with many of our residents who stay in the Rockford area to practice. And so this then allows them, the members of our community, to have access to more physicians. And in essence, it's a grow your own program by having these training programs. And then what's interesting to you, Rhonda, is that there are also spillover effects into the residency program and to our medical school, where students and residents then see that addiction is treatable, the stigma of treatment is removed for them, and they're more likely to want to treat addiction in their practices in the future.
Sure, absolutely. I could see that being very, very valuable for our residents in training. Can you share with us a bit more about the components that would constitute a program like this?
Absolutely. So this would be a 12-month or a 1-year-long program. And built into this program are a host of clinical experiences, chronic treatment of chronic pain, anesthesia, pain management, as well as structured learning and lectures that occur throughout the course of the year related to addiction and the components of addiction and prevention and what works in terms of prevention and how to best perform prevention. Also special populations, pediatric populations that suffer from addiction, or pregnant women who suffer from addiction, or the older patient. If I have a 75, 80, or 85-year-old patient who suffers from addiction because their body is operating differently, how is that then best treated? And so all of these things occur over the course of that year. And then there are some other pieces, if you will, thinking of it as style management. Part of what we were able to do with funding from the Winnebago County Community Mental Health Board was to build the telemedicine suite. And this is where we're at right now, recording this for you. So it allows us access to patients who don't have to come into the clinic for every single visit.
Certainly important in our patient population. Can you speak a bit more? You mentioned a bit, certainly we know we're familiar with training family medicine. Can you speak a bit to the population focus of the addiction medicine program?
Sure. Addiction is a non-discriminating disease. And so it's going to affect our children. It affects young adults. It affects young women, young men, those who are working, those who are parents or children, or grandparents even. So all aspects of individuals are affected. And so in our program, we're really focusing primarily on family medicine and then medicine pediatrics for the most part. And we really look at starting treatment, primarily prevention, but also some treatment at age 10 if they suffer from addiction. We move through adolescence into adulthood. We pick up pregnant women at that time who then suffer from addiction, and then through the timeline of life beyond that.
Thank you. Certainly something like this is quite the undertaking. Can you speak a bit to the different collaborations that took place leading up to this?
Certainly. So, we're very lucky to have a College of Medicine here in Rockford. As you know, we have about 220 medical students that work their way through the college every year. We graduate about 55 medical students every year, going into multiple specialties all over the country. But about half of them, a third to a half of them, will stay right here in Illinois. And Rockford has been a huge beneficiary of this medical school because we have over 230 graduates practicing in the Rockford area. And so we realized, though, that we can't do any of this alone. And so we need partners. We have the medical school as a partner, the University of Illinois Health, Miles Square Health Center, LP Johnson, is a federally qualified health center. It's where our residents practice and our faculty practice. As a federally qualified health center, we're able to see all patients of all ages, regardless of ability to pay, regardless of insurance status. Everybody is seen and cared for. And then we also partner with the University of Wisconsin Health Swedish American Hospital and Medical Group. They're important partners in collaboration with not only the hospital, but our residency program. We see our addiction medicine management moving into the hospital and the emergency room, because oftentimes those are areas where this surfaces. And so this is where we want to be able to provide initial treatment. And then, of course, our Rosecrans Health Network, which is really very important because they have residential treatment facilities, which are an important part for any fellow who is learning and specializing in addiction medicine to be able to understand, see, and appreciate, as well as participating or observing a lot of these group therapies, and then just that entire process of residential and then intensive outpatient treatment.
Great, that's a lot of work and a lot of partnership for sure. Can you speak a bit to the fellowship design and the different educational components that are related to that?
Absolutely. So what we did this past year, one aspect was to really develop the curriculum for this fellowship program. And that's really quite an undertaking, as you know. We have to look at the best programs out there around the country, look at what their best practices are. There are required components that go into every program. And then we have to build that and build bridges to the physicians and the specialties and the organizations that can provide that, because there's no one single organization in Rockford that can do it all. So we have to collaborate on this. And that's part of our partnerships that we bring together. And we build this curriculum, and as you can imagine, it's like a nightmare term paper that's, 70, 80, 90 pages of, 11-point font and single space. But we put that together and then we submit it to a national organizing governing body. And they review it and they either say, yes, you can proceed with this, or no, you cannot. If we proceeded with it without their blessing or their endorsement, then we wouldn't get people to come here and train, because when they finish the program, they would not be allowed to be called addiction medicine physicians because it was not an accredited program. So that's true with all training programs in the United States, and this is the process that we go through to get there.
Mm-hmm. Certainly an important step. Can you speak a little bit more to this space that we get to enjoy right now? Absolutely.
So as I said, one of the aspects in addiction medicine, but really in all of medicine since the COVID pandemic, has been the rise of telehealth and telemedicine. But in addiction medicine, much like in psychology and psychiatry to some point, we know in family medicine to some point, there are visits that make it easy to be a telemedicine visit. And that's true to an extent in addiction medicine as well. So I don't have to have my patient come in as frequently. I might get to a point where I can do every other visit as a telemedicine visit or a telehealth visit. And if somebody is more stable, I may do multiple telehealth visits and then want to see them. So we built this telemedicine suite, but the telemedicine suite also allows us to have students, residents, and fellows observe, and then have our faculty observe them as they are providing telemedicine services. So it's a learning environment and a learning laboratory at the same time that we can actually provide care to patients.
That's fantastic. And I know for sure, just with already so many barriers and access issues to care, the telehealth is an important component. So certainly from a residency standpoint and an educational standpoint, I can see the impact that this could have on our residency program and our trainees. Can you speak more to the potential impacts otherwise?
Absolutely. What we're really trying to do is we're trying to change the face of Winnebago County to allow for additional access and care for individuals who suffer from substance use disorder or opioid use disorder. These are treatable, not easy, but treatable conditions. And we have a lot of tools in our toolbox now. And so we want to bring those forth. Because of the burden of addiction in our Winnebago County, and the fact that we are losing our neighbors, our fellow citizens to this disease, we want to step in and provide the training to add to our workforce so that Winnebago County doesn't have 10% of those who suffer from addiction able to access services, but we want 70, 80, 90, 100% of people who suffer from addiction to be able to access services and receive care. And this is the first part of that, starting the training program, increasing our workforce, bringing others interest into this, affecting our residents who are training here, affecting our medical students who are training here. And it's a ripple effect that then carries out, and affects all of the people that we have here that come into become exposed to it.
So it's such a critical piece, and so many exciting things to come. Can you share a bit more about what the future looks like?
Certainly. So again, we're very excited and very grateful for the funding from the Winnebago County Community Mental Health Board to be able to get this started. We started recruiting last year for an addiction medicine fellowship director. Now, this is somebody who has completed their initial training in a field, such as family medicine, internal medicine, med peds, and then gone on and completed a fellowship in addiction medicine. And then they're board certified in addiction medicine as well, meaning they've taken an exam at the end that's focused just on addiction medicine, and obviously passed that. So we're looking to bring somebody like that in to run this program, to deliver the educational content, to be able to have the expertise of how do I set up an addiction medicine clinic within the emergency room so that I can treat patients as soon as we determine that we've got a substance use related issue or diagnosis. How do I manage patients in the hospital? I mean, you can imagine that a patient comes in with severe pain from a host of things and they start getting narcotics. Appropriate treatment, but then I have to wind that down to come back and treat the addiction, whereas an addiction medicine physician would do something perhaps a little different. They would treat their addiction through pain management, taking into account their addiction, and the patient may be able to go home days earlier. And so we're looking for somebody to come in who we can then help us build these programs for all of Rockford to participate in. And then also to have a robust outpatient clinic so that we're immediately providing access. And we should be able to provide over 3,000 individual appointments immediately when we get started with that. That's our big lift for this next year. And then we have all of our accreditation paperwork ready to go in as soon as we have a fellowship director. And then, of course, lastly, we're recruiting a fellow to be training in the next year.
Very exciting. Well, I thank you very much, not just for your time today, but for your incredible efforts and all the collaboration that went into providing this resource to the community. So thank you so much.
Thank you, Rhonda. And again, we just want to thank the Winnebago County Community Mental Health Board for their funding of this and seeing the vision that we can affect change within Winnebago County. We thank our partners, University of Wisconsin Health, Swedish American Hospital and Medical Group, Rosecrans Health Network, Miles UI Health, Miles Square Health Center, LP Johnson, and of course, our own University of Illinois College of Medicine at Rockford. Thank you.